The following presentation is pertaining to the NDPERS health insurance. This health insurance is provided by Sanford Health Plan. The plan is available to permanent state employees and political subdivision employees if the political subdivision participates in the NDPERS health plan. Eligibility for the health insurance through NDPERS is an employee who is at least 18 years of age, working at least 20 hours a week for 20 or more weeks per year, and holds a position that is regularly funded and not of limited duration. The employee, if eligible, can also insure their spouse and any children up until the first of the month following the child's 26th birthday. Temporary employees may also be eligible for the health insurance, but should contact their employer for eligibility and application. Coverage is determined by the provider that you see. If you see a out-of-network provider, your coverage will be at the basic level. If you see an in-network provider, your coverage will be at the PPO or Preferred Provider Organization level. PPO providers result in less out-of-pocket for the member. The deductible is the same whether you see a PPO provider or a basic provider. A single health policy has a $500 deductible. A family policy has a $1,500 deductible. Keep in mind, deductibles are on a calendar year basis. Copayment amounts are different based on PPO provider status as well as the type of visit. If you see a PPO provider, an office call or regular doctor's visit has a $30 copayment per visit. If you need to use the emergency room services, that would have a $60 copayment per visit. A basic provider or out-of-network provider has a $35 copayment for a regular office visit. Emergency services would again be at $60 at the basic provider level. Coinsurance amounts vary again by provider and level of coverage. If you see a PPO or in-network provider, you will have coverage at the 80-20 level. 80% is paid by the insurance carrier, 20% is the member's responsibility. A basic provider has a split of 75-25. 75% is paid by the carrier or Sanford Health Plan. 25% is the responsibility of the member. If you see a PPO provider and have a single health plan, your coinsurance maximum or your 20% is $1,000. For a family plan, that maximum is $2,000. If you see a basic provider and are on a single plan, your 25% coinsurance is capped at $1,500. For a family plan, this is capped at $3,000. Total out-of-pocket maximum is the sum of the deductible and coinsurance. As you can see, a PPO provider single policy would have $1,500 total out-of-pocket max, family $3,500, and a basic or out-of-network provider is capped at $2,000 for a single and $4,500 for a family. Any co-payments for office visits do not count toward these out-of-pocket maximums. The plan also includes preventive screening services. There is $200 maximum benefit allowed per member per benefit period. For preventive screening services, the deductible is waived, so coverage is applied right away. After you have exhausted the $200 max allowance, preventive services would be subject to the cost sharing or coinsurance amounts. These benefits include one routine physical exam per year, routine diagnostic screenings, and additional routine screenings procedures for cancer. Prescription coverage with the health plan depends on the type of medication. Formulary prescriptions are considered the preferred by the insurance company and therefore have better coverage compared to non-formulary. If you have a formulary generic medication, you would pay a $7.50 copayment and be responsible for 12% coinsurance. For a formulary brand name medication, your out-of-pocket would consist of a $25 copayment and 25% coinsurance. For formulary generic or formulary brand name, there is a maximum coinsurance each year per member. That is capped at $1,200. Non-formulary medications, whether generic or brand name, are not subject to this $1,200 maximum, and therefore an individual could run into higher out-of-pocket costs. Non-formulary medications have a $30 copayment and a 50% coinsurance. If a member is interested, there is mail order available from the insurance carrier. If you have any questions about the benefits described in this presentation, please contact your payroll or human resource department, or you may contact NDPERS